Well, welcome everyone. It's a rainy day. I'm in the low country of our state and it's just raining, raining, raining. And from the weather reports, I think it's doing that in the Midlands as well. Um, so I'm glad everybody can be here today. We're going to talk a little bit about behavior. My name is Susan Thomas, and I do consulting for Family Connections. I am a retired special education director. Prior to that, I worked at the State Department and I actually taught for 18 years, 10 of them, 8 of them in general education and 10 in special education. I started out as a general educator and really wanted to work with students with disabilities. My love has always been those students who have some behavioral concerns, and also I do a lot with literacy. And I've been retired from the public sector now for over 10 years and have done a lot of different things, consulting, working. I now work a little bit with the University of South Carolina at the Academic Alliance. And so I'm delighted to be here today. I would love for you just to take a moment in the chat and please put just what your role is. If you're a parent or if you are here working for an agency, that would be great so that I can kind of see who's in the room. And then I'm going to try to share my screen and we'll get started. I see some people still entering the room. Got parents and case managers. Got somebody from Lancaster County. I have to do a shout out. My son is a principal at North Elementary there, and my daughter is the lead school psychologist for the school district. Dillon and Marlboro, perfect. And Cherokee County, Beaufort represented. Wow, we are spread all over the state today. That's great. Well, I am going to get started. When I start thinking about behavior and us working with students who really struggle and need more support, I just want to start out by saying this work isn't easy. And the demands, it's because we have so many people here that are involved with our Department of Social Services. And then, the demands there, and then our school district demands. And it's always a struggle because these students need the most, and we are lacking resources of personnel now everywhere. And so we've got to kind of start about thinking about how can we be judicious and smart with our time, and um, how can we help parents to navigate within the school, and how do we help schools? And how do we collaborate together? Because I do think that's the big thing that has to happen for us to support these students. Certainly schools can't do it. DSS can't do it alone. Parents can't do it alone. It is a true collaboration. So I'm going to talk about a few things today as we think about this. And then I have provided a few resources that I know Megan will be sharing. So we'll get going here, I hope. Well, maybe. There we go. Um, if you're here, you know about the wonderfulness of Family Connections. They are our parent training and information center for our state. We are so fortunate to have them. I know um, as a former special education director, we need our parent trainers. They help us so much building that family engagement piece that we so have to serve students. So I'm glad that I get to do this work with them. Is very exciting. A few objectives today: just understanding the requirements in the IDEA and for Section 504 for students who have a 504 plan, thinking about the steps to take to address behavioral issues, and then kind of understanding best practices for schools. And I think we have to work together. We have some people that have a lot of behavioral expertise in schools and sometimes they don't. So how can we help work together to put those best practices in place? It's really important. Um, I'm going to start with the law so that everybody just knows what the mandate is. And we'll start with the Individuals with Disabilities Education Act. So for students who have an IEP, IEP teams must always consider. This is a consideration annually, and if you're meeting more than that, more often than that. In the case of a child whose behavior impedes the learning or that of others, the team must consider the use of positive behavior interventions and supports and other strategies to address the behavior. So when a child with a disability is experiencing difficulty that is preventing them from learning, or if their behavior is actually preventing others from learning, then we definitely have to consider using strategies. And the team needs to meet and determine what those will be. We have a plethora of research on the use of positive behavior interventions and supports. It is not, those strategies have to be tailored to the child. It's not a one size fits all. I hear sometimes, well, it's a behavior problem. They need an ABA person. That's not necessarily always true. Those are decisions the IEP team needs to make. But the team does need to come together. That's a requirement. For students who have a 504, those students are identified with disabilities must be provided that free, appropriate public education. If they have behavioral concerns, we need to evaluate to see if those are related to their disability. A lot of our students who come in under and have a 504 plan, I always say a lot of them are all the Ds: ADHD, ADD, ODD, many of the things that come in. And so those are definitely related to behavior, and we need to make sure that we have supports for those students. At the bottom of this slide, there is a link that goes to a document from the Office for Civil Rights that really does a nice job of talking about protection for students with disabilities under Section 504. And so that's a resource for you to take a look at. So I always like to talk about what is behavior. And so I picked my favorite definitions from Webster and kind of paraphrased them. But we think about behavior as the way we conduct ourselves. It's the way children conduct themselves. We all have certain behaviors that were taught and learned as children, even as adults. But also we behave in response to certain stimulus and the environment. And so I always tell people context matters. So you've probably, if you have children, you understand this. I see this now really with my grandchildren. When my grandchildren come to my house and their parents are not there, their behavior is so much better than when we're all together. Because context matters. They're responding to the environment. And so our children do that. And because there are a lot of people here from DSS, we know that our children are experiencing a lot of different environmental stimuli that are causing a lot of the behavior. And we can't fix all of that. Some of that happens outside, not at school, but there are things at school that we can do to structure to make kids more successful. And they need more structure. That's the one thing that we know. So I'm just going to talk a little bit about couple of things about the science of behavior, because I think all too often we forget that behavior is learned. And so if it's learned, it can be taught. But also when we have problem behavior, it can be corrected, but you have to teach how to correct it. You have to teach a better way. And all too often, I think as adults, we start telling students things, we don't teach. And teaching is different. Teaching allows opportunities for practice. There are opportunities for feedback. And that doesn't always happen. All behavior serves a purpose. And we'll talk a little bit more about that. Students are either gonna, us too, everybody. We behave, we get something, we avoid something. I want to get my paycheck, so I do my job, right? We behave in certain ways. When behavior is reinforced, it will occur again. When it's reinforced in it can be in a positive way. So we know that if students are reinforced for what they do well, we've upped the probability of them doing it again. We can also reinforce behavior and inappropriate behavior will happen again. And I'll just give this example. If a student is trying to avoid their work, they don't want to do their work. So they shut down and they get sent out of class. Maybe they even say a few curse words along the way, slam their book on the ground. They get sent out of class. They have avoided their work, which is what they wanted to begin with. They will repeat that behavior again. And so one of the things we have to be, I used to have a school psychologist that says sneaky smart is figuring out, why are they doing what they're doing so that we're not reinforcing them. And so that's part of what we have to talk about when we start looking at student behavior. And we're not going to get deep into that today. That's a whole nother session, Megan. That would be a long session. But that is one of the things we have to think about. Punishment may stop the behavior, but it doesn't teach a better way. So a lot of times if kids are punished, they'll stop immediately. You know, but it won't give them a different way to handle that situation. Meaningful consequences will increase the likelihood that the preferred behavior is something we would want to see in the future. And I always say this, the best predictor of future behavior is the current behavior of the child. It's not going to magically change. And I say that just to say, if a child, and I hear this often, child moves and we go, oh, we're going to give them a fresh start. And we don't put supports in place. We don't want to do that because we don't have evidence. We don't know enough to think just the fresh start is going to help. And if you think about, so it's really important that for the moment that child walks into the school door, if they've had behavior support somewhere else, we need to try to get those same supports in place. We can refine them because sometimes kids do better in different environments. But we can refine them, but we don't want to just say, hey, let's see how they do. That is a real mistake that we make with a lot of children. We need to make sure on day one, if they move during the year, and a lot of children, certainly with DSS or transient, the more we can have those conversations with schools before the child walks in the door, the better off we'll be. So what are the warning signs? When should you start thinking about, hey, I need to talk to somebody? Certainly if your child's getting office discipline referrals, don't wait. If a child, we say that it's okay for any child to get 0 to 1 office discipline referrals during a year. I mean, even the best kids, if they get one, that's no big deal, right? And we're talking about some of those major office discipline referrals. But once a child has gotten 2 to 3 major, and I do mean major, for major things, office discipline referrals, we need to be having a meeting and talking about it, because remember what we said, the best predictor of future behavior is past behavior. And even if that child's gotten a discipline referral and a suspended day, that's not going to fix the behavior. We got enough evidence to support that. If you're getting notes from the teacher, sometimes what happens for students with disabilities is they're not getting office discipline referrals, but their behavior is causing them to miss instruction. And if you're starting to get those notes where behaviors mentioned, the teacher says, we need to work on so-and-so, and then we need to have a meeting, because the support, you as a parent, because we do have parents on here, you can support at home and remind your child of the expectations, but you're not sitting with them to prompt them and correct them at school. And so we've got to make sure we get on the same page. If you're being called to come pick up your child early from school because of behavior, first of all, that's a huge issue. If your child has an IEP, those count as suspended days. I don't care if they weren't recorded or not. Special ed law, the case law has been pretty clear about that. Just because you didn't enter it in the system doesn't mean it didn't happen. So if you're getting those calls more than just 1 or 2 times, then definitely a meeting needs to be called so that we can start learning what can we do. And sometimes it may be appropriate, and it's an agreement you've made with the school because maybe something's going on, you're concerned about it. That's different. But the continual calls, come pick up my child, it's time for you to come pick up. That's a problem. And that's a problem with law too. And then if the IP team starts suggesting an abbreviated day because of behavior, just because of behavior, sometimes this may be appropriate because we do have some children that have existence of other issues that may be appropriate, but we definitely need to come together as a team to talk about what we've done, what interventions we've tried. We can't just putting a child at home is not going to necessarily teach them a better way. Sometimes we might do things like that for a short period of time, but I always tell people my advice to school districts as well is always you need to have a transition plan of how are you getting them back in full day. So those are the warning signs of when you're going to want to make sure if the school hadn't contacted you, you should contact the school. I just had a colleague recently, she's got an adolescent, great kid, honors kid. He just started kind of getting these little random referrals and the school never contacted her. Um, and so we were talking about it and she did contact the school. They've got, remember, they're short staffed. So sometimes you just need to go ahead and reach out when you have those warning signs. Always put that request in writing. Don't, I'm going to suggest that it not be a text unless you download it and save it. I know some people communicate through text. I would start out with either an email or a written note and send it you may send it to the teacher, also copy an administrator on it if you email. And always start out positive because that we get a lot further when we start out with something positive. Thank you, just a thank you for having my child and teaching them every day. Just like we need to start out meetings when we have your child talking that same way. That's the same thing that needs to come back to the school. And if there's something special the teacher's done, give them a shout out. They don't get many, and we can help build them up by doing that. And then state your concern. I see that we're now on 3 office discipline referrals. I'd like to have a meeting. Or you've been mentioning in our weekly notes that there are problems. Could we please set up a meeting? And so, and then follow up to make sure that you have the meeting because it's only when we come together that we can really work on the behavior. I cannot see the chat, so I'm hoping that Megan's going to pop in if there are any questions. I'm going to take just a second. This is a good time. The SC has the highest number of students being preschool kids. Yes. And I know my friends over at the South Carolina Partnership for Inclusion are really trying to address those concerns. And bless our hearts, our little preschoolers, some of them, this is the first time they've ever been to school and they start out in trouble. And so we really do have to try to address that. All righty. Let me see here. So what should you expect? So there's some things in that we know from our positive behavior support, our technical assistance center, just some guidelines of some things that we know are things that school teams should be doing and have in place. First of all, I love to see schools that have school-wide expectations for behavior. Not all of our schools do. Some of them have school rules, but they don't really have expectations everywhere. Some places don't have good, clear routines. I just want to go on record, and I'm not talking about that today, but that is part of what should be in place that helps all students. If we have those routines that are clear, that are written, that parents can even get a copy of to remind students, hey, remember when you are working independently, you're supposed to be doing this, this, and this. And so schools that have those expectations and routines, it's a lot easier for us to teach kids a different way when they're not following the expectations. So you should see a team. And if you've asked for an IEP meeting, we should see an IEP team, and we would hopefully have someone that has behavioral expertise, particularly when we've asked for a meeting to address behavior. Now, many, many times that will be your special education teacher. So I was a special ed teacher and I have a lot of training in behavior, so that would be me on an IEP team. But if there's not, we want to try to get somebody there that can help the team problem solve. And we're not talking about all that today, but it should never just be, we really should approach this from a total team standpoint. And the purpose of what you're doing in this meeting is really to problem solve. There's a problem, and you want to determine what is the problem. The child is getting discipline problems. And I know this sounds simple, but we got to think through that. It's not, the child did not just wake up and decide to come to school and be bad every day. They don't. That's not the way it works. So we have to define that problem, and we have to analyze why it's occurring. And then there needs to be a clear plan for implementation. And then we've got to evaluate what's working. And certainly we need support from families and parents, makes it better. But when kids are at school, it is the school team that is responsible for implementing this plan. You can't be there to sit by your child all day long to make sure they behave. Um, and just telling them at home isn't going to work either. I always tell people, I tell myself every day, I'm only going to eat healthy foods. It doesn't work real well. I start every morning with that message to myself, and, then I end up blowing it, by lunchtime, right? Same thing. That doesn't mean you're not reminding your kids, but, it is only in that time that we can provide correction and feedback. And so that's really important. So when we problem solve, this is what you should see happening. We should be identifying the problem with precision. So what is the behavior that the child's doing? And I should be able to see and count it. What are they doing? Nothing drives me crazy, or my son knows this, that on Power School, when they just have inappropriate behavior coded or defiance, what did they do? What was the disrespect? Was it, cursing? Was it, did they talk back? Did they scream? Did they kick? What is it? It's something that it should be very observable. And that's one of the first things you have to do. And so sometimes, I've had people say, well, they don't do the same thing, but it's all in the category of physical aggression. Sometimes it might be they hit somebody, sometimes it might be a kick, but it's always physical aggression, or it's always verbal aggression. But we need to define it. And then we need to correctly identify, where does it happen? Does it happen in one class, or is it happening across the board? Because if it's happening in one class, then we can start looking at some specific environmental concerns in that class, which may be academic concerns, by the way. It could be that the child struggles with that subject area, and we need to do something to support the child academically, which has nothing to do with the behavioral intervention. But the team needs to take a look at that. And sometimes it may be a teacher that needs more support. I don't know. I don't know if I have any teachers on here, but I always say I need to send apology notes to the kids I taught in the first 5 years of teaching because I made so many mistakes. I didn't have all the skills when I started out. And so sometimes the teacher may be having difficulty and needs support. Doesn't mean they're a bad teacher, just means they need additional help. And so we've got to figure out where it is. And then when is it occurring? Is it during reading? Is it in morning circle time? Is it after lunch? Um, I know, we used to keep a lot of data, and a lot of times we find out some of our students who were on medication for ADHD, that lunch lull, we were seeing an increase in behavior. Well, several occasions I can think of, we met with the parent and we had the time chart of when we were seeing an increase in behavior, and the doctor actually changed the medication, and that took care of the problem. I wish it was always that easy, but you know, that's just an example of why it's important to really track when behaviors are occurring. Now, when kids are having trouble all day, that makes it difficult. Those are tough kids, and we're not going to talk about the toughest situations. We're talking about what I just some of that chronic, I call it annoying behavior that gets kids in trouble. So after that, we've got to, as a team, figure out the why. So in our science of behavior, we know there's always a reason. You're either trying to obtain, get something, or you're trying to avoid. So for kids, they're either trying to gain social, and it can be, or avoid. It can be from an adult or a peer. They are seeking out some kind of sensory stimulation, or they're trying to avoid that, or they're looking for a preferred tangible activity, something they want to do, or they're trying to avoid an activity. But all behavior occurs because of that. Um, and so, I think sometimes we forget about sensory for kids and how difficult it is. I had a student who really every day in the lunchroom, his behavior was just horrendous. During the rest of the day, he was fine. He could not handle the light and noise, and we had our lunchroom was huge, had high ceilings, the sound was loud. We easily put an intervention in place. He misbehaved to avoid, and he got sent out, which is what he wanted. He didn't want to be in there. And so we got him a place to have lunch where he didn't go in there. And with a friend, he could invite a friend every day, and we never had another problem. So that's just an example of when you think through these things, how we can get some pretty simple solutions. Um, we do want to consider other factors, certainly medical and health concerns. We have students on a lot of medication or some of those factors. And certainly home circumstances play a role. I mean, um, if you have things going on in your home, you don't just leave it at the door. Um, my when I was 8 years old, both of my parents got sick. They both passed away with cancer. My home was, although I was very loved, there were a lot of caring people, but I was kind of going from pillar to post. So things were different every day. And so we need to know those things. We can't change them all, but we need to put more support in place. And so we need to make sure that we're clear about those things. Certainly when we have kids that are transitioning in from foster care, um, the more we can know and kind of help make that connection in schools, the better off we are. Teams need to really take the time to discuss those things. It's very important. So just a few examples, just to go through and talk about, kind of thinking through. Um, here's two. Susan yells and throws her paper on the floor during independent work requiring reading between 10 and 12 o'clock and avoids the independent work. So this is my problem statement. We've looked at the data and this is what we've come up with. And I'm certainly not doing anything today on collecting data. We don't have enough time in this training to do that. But there is a way that we collect data and come up with these statements. And we do that by recording the behavioral mistakes in the classroom. Or we could say Susan tantrums with screams during circle time to gain attention from the teacher. So we have, these are two different extremes. One of this is a child with a mild disability. The other one would be a child with a more significant disability that has extensive support needs and an intellectual disability, maybe nonverbal. It's still behavior, it's still disruptive. And so how would we begin to address that behavior? Well, let's talk a little bit about some agreements, okay, that we have to have as a team when we're working on this. First of all, we really do have to redefine punishment. Punishment might stop a behavior, but I love definition number 4 of Webster that says punishment, the discipline, when we think about discipline for students, it is not punishment. It is the training that corrects, molds, or perfects the mental faculties or moral character. So when we talk about a tough discipline, it should be about teaching. And I compare this to in schools, like when I talk to people that run ROTC programs, they use a disciplined approach of kids practice. They teach them again and again, and they practice. They don't just kick them out. And so I think we have to address it from that standpoint, and we have to agree that a punishment is not going to change the behavior. We have to teach. And so sending a child home for a suspended day, do we have to do it? Absolutely. Do discipline codes require it? Yes, sometimes. But what those days should be for is so the team can come together to figure out what are we going to teach and how are we going to fix this environment. And so I think those are conversations that school teams need to have with parents. And I quite frankly think when we as agencies are working together collaboratively in IEP meetings, this is really important for us to talk about so that we can all be working on what are we teaching. And when we teach, reteaching and practice are always included. So it's going to take more than one time. It's going to take more than 2 times. It's going to take more than 3 times. I get tickled a lot when I hear a teacher say, well, I've been telling them. Well, you know, there are things that my son is almost 40 years old, and there are things I've been telling him for 40 years. And so now he says, I'm a grown man, Mom. Now I don't need you to tell me that, right? But there's still things that we need reminders of, and we need to practice correctly. So just because you told them at the beginning of the year does not mean that was a skill that they have or that they've mastered. And so we have to think about that. The other thing we have to agree on is there's one thing we can control, and that's the environment. I cannot control, and if you've ever tried to control a child, you know that's not possible. If you have your own children, surely you know it. I have a little granddaughter now that's almost 2, and it's just fun to watch, right? I'm not going to stop her from tantruming when she decides to tantrum, but I can control the environment around her and my response. And so one of the things we want to do with our school environment is we want to prevent. We want to spend our time thinking about what is it that we can do that will decrease the likelihood of this behavior occurring. It's extremely important that we spend time doing that. And what I try to tell people, and it's hard, and I know it's hard, is none of us have time to sit and think about all this and do it. But if we spend the time on the front end addressing the behavior and getting those preventions in place, we can gradually fade them. But if we don't, we're going to still be spending time because we're going to be in 50 million meetings because things are not working. So prevention is where we really want to think because those are the things that we can easily put in place. We just sometimes have to think outside the box, and it takes a team to do it. And that's really important. The other thing that we have to agree on is that we can teach a better way. We will teach behavior just like we teach academics. When students don't know how to do something, we're going to teach them. And that is different than counseling. Instruction gives opportunities to practice with speed with feedback. And so we've got to make sure that we're not just putting students in for counseling. If we are, that we're using more of a cognitive behavior therapy where there's a strategy that we're teaching the child, that we're having them practice it, that we're giving them feedback on it. But we have got to teach. And that means that everybody in the building, if we're teaching a child to do something, we've got to make sure everybody in the building knows so they can prompt the child to do it. So when I train teachers, I go, it's just like if you're giving a child a strategy, and I like examples. So apparently my granddaughter, who's almost 4, I have 5 grandchildren. I got good stories now about children. Um, she may need a behavior plan, but apparently she's doing a lot of blurting out in her class and not giving her classmates time to answer the question. She's 3, right? So her teacher has a strategy that as soon as the teacher's asking a question, she signals Margaret, and Margaret puts her hand to her lip to remind her not to blurt the answer out and wait her turn to give another child a chance to call, right? So we can teach those things. But then if we're teaching a child that in a school, everybody else has to know what that strategy is so that they can give the reminder. Because I'm pretty sure Margaret probably forgets to do that. And then you can give her the reminder, remember. And so we want to make sure that when we're doing those things, we have those, we are also sharing it with everybody that's going to deal with the child. So that's a very simple way of looking at behavior. I want to be very clear. This is a short training. We have kids that have much more complex needs, and it's very complicated. And I'll talk a little bit about that in a little bit, about what we need to do then. But then we as a team want to create a plan. This isn't a formal behavior intervention plan. This is just a behavior intervention plan. I call them little BIPs. Um, so they're little behavior plans that we can put in place together. So what are we going to change in the environment? What might we put in place? What will we need to teach? And how will we reinforce it? What's going to be reinforcing for the child? A lot of times we need to ask kid what's reinforcing for them. So it's funny what students want, all kinds of things. And then who's going to be responsible for making sure all of this happens? That's the downfall, is a lot of times we leave with a meeting with a good plan, but nobody's in charge of making sure it all is a go. And so we want to make sure we cover that in the plan. And then how are we going to determine whether it's working? That's really important that we leave with a plan of how we'll measure. So I may have a student that, part of their environmental changes that I'm going to, I'll just use the child in the lunchroom. We actually ended up moving him to a quiet spot for lunch. That was an environmental change. We did start working with him on things to do. We taught him what to do with noise and stimulation, and one of them was accommodation of noise canceling headphones and when to use those and how to use them. And then his behavior was reinforced. He was actually on a contract system that he was earning points for different things, and that worked very well. We continued that contract system with him. So that's just a little example. And those are things that, yes, they take time, but if you get a system down, and if schools have systems, it becomes pretty automatic. And kids do respond to those things. So just an example, Susan yells and throws her paper on the floor during independent work, requiring reading between 10 and 12 o'clock, and avoids independent work. That's the behavior. So for the environment, her reading skills, her actual reading skills are not on grade level. So the first thing we're going to do is we're going to give her lower readability material so that when she sits down to do independent work, she can do it. It's something she can read. Because, see, she found something else to do when she couldn't read it, and that was not behave. And then we're also going to teach her a strategy for if she gets frustrated or the work, she can't do the work. And we're going to give her a visual reminder of that. And this is just an example. Stop what you're doing, use your help card, and wait quietly for help. And so she's going to have this visual on her desk to remind her along with her help card, right? And we're going to teach her how to do it. Here's the trick. You have to teach that in isolation. You don't teach it during class time. You teach her that and you do a little role playing of here's how you use this. And then, what we're going to do is we do have to make sure the adults respond. So I've been in classrooms sometime where we've given kids a help card and then nobody came to help them. That won't work either. So if they're trying to get help because they can't do the work, then we have to make sure it gets to them. So that's just a little example of something we might do. For the child who's tantruming and screaming during circle time, we're going to provide a communication device during circle time because while we were problem solving, we realized she wanted to participate. So she needs to have her device with her. That's how she talks. And a lot of times we see people only giving kids their device when they've decided they want them to talk. But circle time is a time when all kids should be participating. They should have their communication device with them. And then we're going to have an activity that allows her to go to the board, and we're going to plan for her to be able to access because after talking about the situation, all the students were getting to go and point at the whiteboard and, with the magic wand, and she wasn't being allowed to do that because she was in a wheelchair, because it was going to take a little extra time. So we're going to make sure she gets that time because she's screaming because she wants to be part of that group and have the attention from the teacher and her peers. And so those are things that we would do to address that. Just a reminder, when we teach, we're going to teach in isolation. We're going to use prompting with her, and then we're going to reinforce when she asks appropriately and needs help. So how will we know? We can put these little interventions in place, but how will we know when they're working? Definitely daily progress reports are a great way. There are a lot of data collection tools that teachers can use, but we want to specifically name the behavior we're expecting to see. We can contract with students. We can use self-monitoring. I have lots of examples of those. Because of the time of this meeting, there's not time to go into all of those, but I will tell you one of the things you want to make sure of is that you're addressing the specific behavior you're trying to change. And I always like to write them in positive terms. I used my help card, and you're going to track the number of times they used it. You should never have things where you're tracking what the kid didn't do because that's reinforcing the you're putting emphasis on the negative. We want to put all the emphasis on here's what you're supposed to be doing. A couple of reminders. Kids will have behavioral mistakes. And I have a friend that always says, did you think you had cured them from, I had a child with autism that had been doing really well. And then all of a sudden we had like 4 really bad days. And I called to ask for some help. And, he said, that is part of their disability. And so we have to remember that. And mistakes are used for learning for us as adults and learning for the child to reteach the child. We should never be blaming and shaming. And if I could wave a magic wand, that is one thing I think we need to remember as school personnel. And yet I do feel for our school personnel because I do know how hard it is. It's hard when you're dealing with that all day long. And so, but we do have to remember that and remind each other and support each other. And remember that part of that, when the child makes the mistake, we're going to reteach, practice, and praise. And so a lot of times I'll see people will put a little behavior plan in place, and then the child has a behavioral mistake and they get written up. Well, we've defeated the purpose. Let's try to use that as reteaching and a chance for them to have an opportunity to practice again. If you're using additional consequences, so, a lot of times we want to do something to keep the behavior from occurring. I know for my son, he was very social, so removal of the social privilege, I used a lot of if then with him. If you don't do this, then you're not going to get to do this, right? So if you're using additional consequences, remember they have to be meaningful. So, we're going to remove a preferred activity. But I see people remove activities all the time, but they're not preferred activities for the child. So I can go in a lunchroom and see a lot of kids sitting at the silent lunch table. They don't care. They're there every day. So that is not a meaningful consequence. If they're there every day, I tell schools if you try that 3 or 4 times is not working, wasn't meaningful. There are always natural consequences of things you might not get to participate in or do because you didn't make the right choice. And then, of course, removing from social activities or adults and peers. It's got to be meaningful. A lot of kids, I remember I was working in a school. Every time I went to the school, same kids sitting outside the assistant principal's office. I would go like once or twice a month. He liked it there. It was a good place to be. So he learned to misbehave to get there. And so that wasn't a meaningful consequence. So I just remind you of that, as y'all are talking, because as a team member, if you see that what's happening is these same consequences, and the kids still with the behavior, we got to change. Something's got to change. And it shouldn't just be jumping from, some kind of small consequence to now you're out of school. We have to help people think of something different. So for kids with more complex behavior, we certainly want to do a more formal functional behavior assessment, behavior intervention plan. That's another whole training. But I do want to talk about when that has to be done for students. Certainly, we know the Individuals with Disabilities Education Act, we have what we call a change of placement in 10 days. Um, there is a little loophole in the law. I'm not going to talk about it because I advise most schools that on the 10th day, on day 11, we need to be coming together. Now, my rule of thumb in my district was we didn't wait till day 11. If we saw behaviors creeping up that were getting that child suspended because they were in district policy, we were going ahead and having a meeting to prevent the problem behavior so that we could keep them from getting to 10 days. But we do have to have that. If we have a child that comes up in a behavior manifestation meeting, and if it's a manifestation of the disability, the law requires us to conduct or review the current functional behavior assessment and behavior intervention plan. And I will say this, many of you probably have students that have a behavior intervention plan already. You should never leave a manifestation meeting without that being well, you can leave the manifestation meeting, but the plan should be revised. Because if the plan was working, you wouldn't have gotten to manifestation. So if teams say, oh, we're just going to leave it like it is, that needs to be changed. You need to ask for it to be reviewed because it wasn't working. That could be because the adults weren't implementing it, but it could be that what's in there is not effective. So you should always be looking at that. And then I put a reference to the law so that you can read about that. And then under 504, the district must conduct a manifestation for a student who has a disciplinary removal of more than 10 days. And then the same thing, the manifestation, if there's a manifestation to see if it's related to disability. I will tell you that drugs and alcohol for students just under 504, not students in IDEA, are excluded. And then of course, if the behavior is a manifestation, same thing it is an IDEA. The big difference for students with 504 is they do not have to stay in their current placement after a manifestation meeting. And so a lot of times we're writing a functional behavior assessment for a different placement. There's a great OCR guidance document, Office for Civil Rights guidance document that I've linked to here to help with understanding that. This is a book, guidance document from our Positive Behavior Intervention Sports Technical Assistance Center, sponsored by the Office of Special Education Programs federally, strengthening family participation in addressing behavior in an IEP. So it's got some great resources in there. If you download it, it's really nice because you can click and get to other resources, which I really like. This is another great resource. It's called The Behavior Doctor. Material support for behavioral intervention. She has a couple of documents. There's one, and I've downloaded it, talking about the IEP and behavior. She has some wonderful resources. And I'm done. Just a reminder that Family Connections is always available to help and support. I know those of you working with DSS work with them regularly, but they're just got a lot of wonderful resources on their website. And also, if families need additional help, you can contact them. And I will stop sharing and I'll check. I don't think I have any questions, but I will. We've got a couple of minutes. If anybody, I've got some, I'm getting down to it. Looking at a neuroscience approach. Any questions? Certainly also, if you have questions and want to send an email, please feel free. I'll be glad to come back if I can help find something. I'm always glad to help. Sometimes you think through things, say, I wish I'd gotten this information. There is an evaluation in the chat box. If you'll take just a moment and fill out that evaluation, that would be great. I hope that I've given you some tools to help you as you think about being in meetings, and remember that you are equal partners, all of you, parents, agency, school, district. We really do have to come together as equal partners and help each other. So please make sure that you fill out the evaluation, and I will be here for just a second if you have any questions.
Hi, Susan.
Hi.
I have a question. It seemed like this school year, a lot of our children are getting straight expelled immediately for, the one infraction. And I know our children are very, and I work for DSS, and I know a lot of our children have a lot of behavior issues because they have a lot of trauma. But a lot of times when we get into the meetings, even if they have an IEP or 504 plan, it's like the schools, number one, just feel like they can't control the behaviors. They ask us as DSS, well, what do you want us to do, or what do you suggest we do, and things like that. And it's not a matter of us coming together to try to figure out a solution or to training or what have you. It's like they're looking for us to fix the problem or just remove them. And so I guess just needing more clarity on about, like, for example, I was on a manifestation meeting the other day, and a child just had ADHD was her disability, other health impairment. And she did curse out several people on the way to the office, but she had tried to get assistance from the teacher because she felt like some girls were bullying her and picking at her. So she told the teacher, nothing happened. And then she wrote a note to the teacher, and the teacher's like, well, I didn't see it. And so, go sit down. And so that made her escalate, explode. And it, because I guess the girls were still maybe teasing her, taunting her, and she exploded. She cursed all the way to the administration office. Got to the manifestation hearing. Oh, well, that's not related to ADHD. So she's expelled. She's expelled. And so it's like we tried to argue the fact that, well, she got fixated because of her ADHD. She got fixated on those girls instead of being able to reconvene back with her schoolwork and concentrate on that. And so that was kind of related to her ADHD, but they didn't see it our way. And it was like us against them. And I think that's what we're up against so many times. And that's just, one example. So how can we better, I felt like, how could I better advocate for her?
Oh,
Hmm.
so I think there are some issues of, I think there, as you well know, we're shorthanded, just like y'all are. Just like
Mm-hmm.
y'all are. I mean,
Yeah,
and the skill level a lot of times of people being able to handle things is not there in the training. And so I think one of the things that I think we need to start doing, and I know this isn't going to fix that problem, but I think we've got to start meeting together as interagencies to talk with our district about how are we going to manage. And some of our districts do this. And making sure that people have that training and that teachers are receiving the training. So my guess is that girl has had some explosions before, right?
I think she's had one other incident. I
Yeah.
think
I
she's had,
mean,
yeah.
I mean, most of the time it's not it may not happen all the time, but if we
Mm-hmm.
know that, then we want our teachers to be on alert and try to get them used to, I'd rather prevent the problem than
Mm-hmm.
you know having and so even if you send that child, having a safe place for that child to go. I just know when I taught a support classroom for most of my career, and a lot of times, and this been years ago, the kids would just, they would send them to me and I could be a little quick calm down place in a smaller environment. And so a lot of times thinking through those things and helping schools before they get there, I always say this: when you've gotten to the manifestation part, you know, I hate manifestation because I'm
Mm-hmm.
like, why are we even, why?
Mm-hmm.
Because what we got to do is get kids for in place. So I would really look at, you can always ask to go back in and review that. She
Mm-hmm.
does have that, you do have a right to do that.
Yeah.
So if the and sometimes we need to take that option. Now, I will also tell you before you go and file a complaint or due process, or the parent on behalf of the parent and child, let's try to go back and talk to the special ed director.
Okay.
And because sometimes, we make mistakes. I certainly, as a director, we had some mistakes, right? That doesn't mean we
Mm-hmm.
can't fix them. I
Right.
used to always say we can have a do-over. Um, and then let's work together to see what we can put in place. The goal needs to be for kids to be in school.
Mm-hmm.
But I know some of these kids can be tough. I get it. I get both
Mm-hmm.
sides of it. I see both sides. So, um, I think, and I think, I see somebody here writing a lot about the law. Certainly, there's things that we can do within the law, and thank you for putting those things. But I always have tried to approach things from, let's see what we can work out.
Mm-hmm.
Because once we go down that road,
Mm-hmm.
it's a different ball game.
Yeah, because I've tried to appeal expulsions and I have never been successful with those. So we always try to get involved and try to assist frontline case managers at, but we would like to be able to help before the manifestation hearing, but we would definitely be in attendance at that hearing to try to advocate and fight before we go any further to bring it
Right.
back to the IEP team.
And sometimes that's schools having, and this might be
Mm-hmm.
something that y'all might, this is when I talk about agency work. So,
Mm-hmm.
and it's systems level work, right? So in our district, we kind of had a policy that when we didn't just automatically put kids, principals just didn't automatically put kids up, right? There's a
Mm-hmm.
lot of leeway. Now, there's some things that principals have no option for, right?
Right.
I mean,
Oh
it's in
yeah.
their, I mean, we know, I'm not
Right.
talking about those things. A child cursing down the hallway is not one of those things. There's a lot of leeway there.
Yeah.
So sometimes those might be discussions. And so those are things that possibly to advocate, not in this situation, but for other kids, is for y'all to meet with these districts and say, can we get some things in place
Mm-hmm.
so that we're not sitting in a manifestation? My goal
Mm-hmm.
was to avoid manifestation at all costs.
Yeah.
you know,
And we are working because when we're once with some of the districts, we're trying our best to create an MOU where we could perhaps put BMOD services in place because we have BMOD, that we can
right.
contract with, but the schools, of course, kind of block that and say, well, we can't have a non-district, employee in our school system. So we're trying to come together and work to create that MOU between DSS and the school system to try to say, hey, let's look at this. And so that's just been a slow process as well,
Right, right.
and
But
a
that's a
lot of
great,
red
that's
tape.
actually, yeah, and that's actually a great idea, but I do
Mhm.
know, I do understand the red tape with that. But
Mm-hmm.
I would think that would be something that could be to work. But I hear you though.
Yeah,
It is.
it is.
Um, it's hard, and we don't have enough resources. I really,
They don't.
and I mean, y'all don't, and certainly our schools don't. But I do think if we can try to get on the front end of more things, we can prevent, and making
Hmm.
sure teachers have information. And I do think one of the things is a lot of times, somebody handles, that transfer in of a student, and the information doesn't trickle down to all the teachers.
Hmm.
I mean,
Exactly.
it's a problem. I know that
So
didn't help you, did I?
well, I mean, I'm always on training. I'm always willing to learn anything new. But and also, I'm so glad to see a lot of my colleagues from DSS on this training. I sent it out to all the different counties, so that's why it went out kind of statewide. And so I'm glad they're on here. But I just also want to give a plug to them that our kids need the protection. They need some type of support services. They've been through a lot of trauma and things like that. So it will not help them if we do not have that in place in the front on the front end. So please put that in writing, like she said, and we do have a template that we can give you all from if you work for DSS. And I just sent my email, put my email in the chat. I'm sorry for my shameless plug, Susan,
Oh,
but
I love your
we
shameless
have
plug.
a template letter that will help guide you on how to write to request for IEP or 504 plan. Family Connections has a wonderful one as well. If you're not with DSS, but please email me and I can get that out to you all, because too many times we get to expulsion hearing and our children don't have a 504 plan nor an IEP, and they don't have much of a leg to stand on if they don't have anything.
And I'm so glad you said that, because I think that is one of the issues. I've had so many
Hmm.
kids, I'm like, what, why didn't this kid come up? And I was in a very large district when I retired, so I wasn't hands-on with every case. And I'm
Hmm.
like, but if we have a child coming in and they've got that diagnosis and
Hmm.
they're having those things, we need to get in and get protections in place early.
Right,
And so I
right.
think that's one thing that we can do. And also, I would just say, if, I know y'all are short staffed, but never be afraid to say the things that should be going on in a meeting and ask the
Hmm.
district to do it. You know,
Exactly.
be active, because that helps.
Okay. Thank you so much.
And thank you. Thank you for the work you do.
No problem. Thank you.
All right. Well, thank you. I appreciate it. And y'all have a great rest of the day. Stay dry if you're in one of these rainy areas.